If you just look at the number of people who died in a particular month pre-COVID, that is in 2019, it stands around 12,107, right? But as per our data in 2021, we have around the same number of people, around 12,000 people who are dying in a span of 10 days itself.
The harrowing images playing out from cities and towns across the country show mourners lined up outside crematoriums, rows of funeral pyres burning with hardly a break, last rites arrangements being hurriedly scrambled for the rising number of dead. Records accessed by the Indian Express show that in the capital, currently the ground zero of the fierce second wave, these images frame a growing gap between the numbers laid to rest and those put on paper as the official COVID death toll. Death certificates, hospital reports, and data from the capital's main crematoriums and cemeteries, maintained by Delhi's 3 civic bodies, reveal the unprecedented scale of an unfolding tragedy that goes beyond the daily COVID dashboard.
We looked at the data of these 3 MCD zones from April 18th to April 27th, so it's a 10-day time period. In this 10-day time period, the Delhi government in their official health bulletin have stated that 3,049 people have died, right? But when we look at the data and we look at the number of people who are laid to rest as per COVID protocols, you have a number which comes up to 6,958. So these are people who are cremated inside these 23 crematoriums all over Delhi as per COVID protocols. So these are people who A, have tested positive for COVID and died, or B, are people who are categorized as as suspected cases since they had these COVID related symptoms. So they're also cremated in this figure, which is why there is a big mismatch.
The data also shows an alarming increase in people succumbing to COVID when compared to deaths in a pre-COVID year.
But if you also look at this other alarming figure is the fact that 5,111 persons were laid to rest as per regular COVID protocols. Now, if you sort of look at the data, in the NDMC zone, you've had 2,998 funerals conducted under COVID protocols. And in the South MCD, the figure is much higher. It's up to 3236. And the lowest figure is at the EDMC, which stands at 724, right? So if you just put this in perspective, if you just look at the number of people who died in a particular month pre-COVID, that is in 2019, it stands around 12,107, right? But as per our data in 2021, we have around the same number of people, around 12,000 people who are dying in a span of 10 days itself. So that sort of shows this steep rise which is taking place in the pandemic.
Interestingly, according to several doctors, crematorium workers, and health officials, the mismatch in government data and actual deaths is also because of other reasons. Those dying at home due to COVID, either because of a lack of medical equipment or treatment, do not have COVID positive certificates as their COVID tests are delayed by several days. So officially, these deaths are classified as non-COVID related. There are also cases of people with other illnesses like kidney ailments, diabetes, losing lives due to lack of healthcare as hospitals and medical staff are stretched thin. While all confirmed COVID deaths receive a COVID protocol funeral, the real danger is that suspected COVID-related deaths are cremated under non-COVID protocol.
So basically, a COVID protocol funeral, it's basically a list of standard operating procedures, which has been set up by the Ministry of Health. They were released in 2020 and they keep getting updated. But they mostly stress on, how these patients' bodies are supposed to be handled all the way from the hospital till the crematorium. It stresses on hand hygiene and, about how you're supposed to cremate these bodies, and how these bodies are supposed to be wrapped in a body bag which is supposed to be decontaminated. But the main point is that there should be absolutely no contact with the body. Now what happens is that there is a increase in the cost of ambulances and ambulance rides, and then there is a lack of refrigerating facilities. So so people are not really keen on getting a COVID report test, is what I have been told by many of the people, crematorium workers, and some of the people that we have spoken to at these funeral homes. And so they go and merely state that that their relative or whoever, they just died under very normal circumstances, and these people are buried under your regular wards, right?
Apart from the challenges to the standard operating procedures, the sheer scale of deaths has taken a debilitating toll on crematorium and funeral workers.
These people, the crematorium workers that I have spoken to, and I've spoken to multiple crematorium workers, they have been exhausted. They're exhausted. They're scared. But then in this wave, what has happened is that they are working round the clock. Now, for example, the Nigam Bodh Ghat has seen over 1,400 cremations. So I spoke to the crematorium in charge, Mr. Abhadesh Sharma, and he and his staff are basically waiting for a massive wave to hit, is what they're saying. They're saying that several of their workers are so tired, and many of them have left.
With the COVID second wave not relenting anytime soon, these crematoriums will continue to see long queues for some time.